Calling the first Committee on Human Services hearing for the 2022 regular session, 3:10 p.m. calendar. First up is SB 20, excuse me. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business at 3:10 p.m. February 1st, 2022, conference room 225 NY Video Conference. And a public notice will be posted on the legislative website. For testifiers participating remotely, your audio will be muted and video disabled until shortly before it is your turn to testify. Right now, because we don't have many people on the calendar except, there won't be any time limit except that if you have had written testimony, because we do have a, we have to end at 4 p.m. We may start putting a time limit on your testimony. If you have written testimony, please rest on them and just add to it because there will be time for questions and answers. I'll be reading a list of individuals who submitted written testimony for each measure. We apologize that the closed captioning doesn't accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You'll find the link on the status page for the measure. So present at this first Human Services hearing are remotely, we have Senator Kurt Favela, and we have Senator Laura Ocasio and myself. First up, SB 2343 relating to family court. We have Rod Miley. Mr. Miley.
Good afternoon, Chair San Buenaventura, members of the committee. My name is Rod Miley. I'm the Administrative Director of the courts. We certainly understand the need for this bill, but we respectfully oppose, but we'd like to suggest alternatives to address the underlying concerns of the bill. I won't read my testimony. It comes down basically to that if all of the family court orders are given direct appeals, including the ones that probably would be, sufficiently disposed of through the ICA, then all of those cases come before the Supreme Court, which adds to their existing caseload, and it doesn't necessarily help matters. The specific cases that were cited, I think our research indicated that although the time period seemed to be rather inappropriate, the research indicated that there were other things going on other than the compelling interest of things like child custody or other kinds of rights pertaining to the children. What we would propose is that the opportunity be given for the parties to petition to have their case heard by the Supreme Court rather than a mandate that all appeals from family court orders go directly to the Supreme Court, whether people wanted that option or not. I'm here to answer any questions. I also have with me this afternoon Shelley Park-Ho'opili, who is our chief staff attorney for the Supreme Court, if there are any technical or procedural questions that the committee members might have.
Okay, thank you very much. Okay, no one else has registered to testify orally. We have written testimony also from Shelley Park-Ho'opili, as well as Robert Cartero and Dara Carlin, the latter two testifying in support. Any questions, members, to Mr. Miley or Ms. Park-Ho'opili? Okay, I just have a few questions. Mr. Miley, I looked at your testimony and I see, and I've also looked at the bill, and the bill, it seems to me, refers to an interested party may appeal and doesn't require, you shall be, yes. If we put in your proposed amendment, which is to authorize the Supreme Court to review a grant and application for a transfer of any appeal in the ICA, will that satisfy the judiciary?
Yes, that would be consistent with what our recommendations would be.
Okay, thank you very much. Any questions, members, based upon that? Okay, nothing further. Okay, thank you very much. We're moving on to the next measure.
Thank you.
Next bill, which is SB 1294. Testifying for SB 1294 is Director. Okay, well, I see Judy Moore Peterson here, testifying for Department of Human Services and Support. Okay, Ms. Moore Peterson, please proceed.
Thank you so much. Thank you for that. I'm Administrator Judy Moore Peterson, a MedQuest Administrator on behalf of the Department of Human Services. We're testifying, I stand on our written testimony in support of the intent of this bill with a respectful request that the appropriation be added to the executive budget. The governor's budget priorities did include restoration of the basic adult dental benefit, and we have included those dollar amounts in a written testimony if people are interested. Thank you.
Okay, thank you very much. Next up is testing for Ms. Craig Hurai. Oh, no, he had provided written testimony. Aloha Care. Do we have Aloha Care present? Okay, Peggy.
Yes, Chair, we're present.
Please proceed.
Yes, thank you. Just want to stand on our written testimony and thank you so much for hearing this bill. Aloha Care has been supporting the restoration of adult dental benefits for 10 years now, and we're just so excited you're hearing this bill and look forward to moving it along. Thank you.
Okay, thank you very much. Next up is Nancy Partika testifying for Oral Health in Progress. Okay.
Hi, Chair, not present.
Okay, not present. Next up, I see Kelly Lopez for AARP. Okay, we have Audrey Sugan Nakagawa for AARP.
Good afternoon, Senator and members of the committee. I'm Audrey Suga Nakagawa, the Advocacy Director for AARP Hawaii, and I stand our testimony in strong support of restoring the appropriation funding for dental care and the benefits for the adult Medicaid enrollee. We strongly believe that this is something long overdue, and we're very glad to see that there's an opportunity that it will be able to be restored so that our seniors and all others will be able to get good dental care. Thank you.
Thank you very much. Next up, Jonathan Ching in support for Kaiser Permanente.
Afternoon, Chair. Yep, Jonathan Ching for Kaiser Permanente. We will stand on our written testimony in support of this bill. Thank you.
Okay, thank you. Next up, JC Mikulinek for Queens Health Systems in support.
Aloha, Chair. J.C. McEllick for Queens. We'll stand on a written testimony in support of this measure as well for the reasons outlined by others. Mahalo.
Okay, thank you very much. Next up, Anthony King, Dental Director for Waimanalo Health Center in support. Dr. Kim.
Good afternoon, Chair. I'm Anthony Kim. I serve our community at the Waimanalo Health Center as Director of our dental program. Please support restoring comprehensive adult dental Medicaid benefits. Without your support, the Medicaid population of adults across the state of Hawaii will continue to be deprived of access to oral health and continue to suffer from the effects of neglect. I'm very happy today to see this bill return. We've been in strong support of the return of these benefits since they were cut in 2009. It happened to be the year that we started up our services in Waimanalo, and we were met with a overwhelming demand for now uninsured services that were completely underfunded, and we were facing really, really difficult decisions out there with this population as far as losing vital, healthy teeth. I'd like to emphasize that the bill as read may include some options on there, and we are in support of a full comprehensive benefit. And anything less, and we start to have to make decisions on access to services that such as root canals or crowns and things like that. And what we start to see is the loss of vital, healthy teeth that could otherwise be saved. It's been over a decade now. I've seen my patients grow up. I've seen them transition from teenagers to adults and meet adulthood with no dental coverage. They've gone on and suffered the ravages of dental disease. And I can't emphasize enough how important this is to this vulnerable population, how impactful it could be for a future healthy Hawaii. Please, members of the committee and Chair, support this bill. It's long overdue. So I'd like to weigh in with that. Thank you.
Thank you, Dr. Kim. Okay, next up, I see Patrick Donnelly for Hawaii Oral Health Coalition. Proceed and support.
Thank you, and good afternoon, Chair San Buenaventura and members of the committee. I'm Patrick Donnelly. I'm the statewide Oral Health Coalition Manager for the Hawaii Public Health Institute. And on behalf of the Hawaii Oral Health Coalition, we respectfully urge you to pass this measure. We know that since 2009, adults on Medicaid have only been covered for emergency services like extraction and pain management. And today we continue to see the overutilization of the emergency department for preventable oral health conditions. We know that between 2016 and 2020, that there were nearly 30,000 visits to the ER for non-trauma related dental concerns, and 2/3 of those visits were due to a principal diagnosis. So that means that that's the main reason that they went in. The highest rates are on neighbor islands and among younger adults aged 21 to 44. And Medicaid claims in those years constituted nearly half, or about $12.3 million of cumulative charges for ER visits with a principal diagnosis. So this doesn't even include, charges that were applied to secondary diagnosis. We know that oral health has a strong relationship to chronic conditions, pregnancy, economic opportunity, and social emotional wellness. And to Medicaid patients, lack of adequate dental coverage is an extra hindrance to wellness that we really can no longer afford. We continue to talk about the issue as a matter of benefits, but I personally wonder how much does one really benefit from a pulled tooth and a prescription. The continued lack of essential coverage in Hawaii has denied equitable access to its most vulnerable residents. And as we continue to endure this pandemic, we continue to observe the importance of overall health status in determining outcomes, and oral health is absolutely integrated. So the last place an individual should be seeking care for preventable dental problems is the emergency department. So again, on behalf of the Hawaii Oral Health Coalition, I respectfully encourage the passage of this measure. Thank you all so much for the opportunity to testify.
Okay, thank you very much. Okay, no one else having registered to testify by Zoom. Is there anyone who has come in late? No. Okay, also testifying in support, there were comments from Budget and Finance. In support, we have the State Council on Developmental Disabilities. We also have Ho'ola Lahui Hawaii in support, Hawaii Disability Rights Center in support, Park of Maui County in support, Hawaii Health and Harm Reduction Center in support, Ohana Health Plan in support, Early Learning and Health Director, Kathleen Allgaier in support, Ho'ola Lahui Hawaii in support, Bay Clinic Inc. in support, ACOG Hawaii Section in support, Hawaii Health Association of Health Plans in support, HMSA in support, Hawaii State Rural Health Association in support, Kokua Kalihi Valley Comprehensive Family Services in support, Hawaii Primary Care Association support, United Healthcare in support, Early Childhood Action Strategy, Hawaii Dental Hygienists Association, Papa'ola Lokahi, Full Life, Easter Seals Hawaii, Hawaii Family Caregiver Coalition, a group of individuals called Hawaii Self-Advocacy Advisory Council, West Hawaii Community Center in support, the Dean of John A. Burns School of Medicine in support, and 14 other individuals in support. Nobody testifying in opposition. Anybody else wishing to testify on SB 1294? Questions, members? Okay, seeing none, we're gonna move on. Oh, next up. SB 2150, relating to temporary assistance for needy families. We have, oh, I'm sorry. Yeah. We have Scott Morishige, Governor's Coordinator on Homelessness.
Good
Scott.
afternoon. Good afternoon,
Yes.
Chair and members. Scott Morishige, Governor's Coordinator on Homelessness and Chair of the Hawaii Interagency Council on Homelessness. I stand on my written testimony in support, provided that this bill's passage does not replace or adversely impact priorities in the executive budget. Thank you.
Okay, thank you very much. Next up, we have Director of BESD. Well, Catherine Scardino for the Director of BESD. In support. Please proceed. You are muted. Perfect. Please proceed. You're not muted anymore.
Okay. Good afternoon, Chair and members of the committee. My name is Catherine Scardino. I'm a program administrator here to testify on behalf of DHS. The department stands on its written testimony in support of the measure and offered comments. We are here to answer any questions from the committee members.
Okay, thank you very much. We also have Betty Lou Larson, Catholic Charities Hawaii, in support.
Chair Sampono-Butera and members of the committee, thank you so much for hearing this very important bill. Catholic Charities stands on our written testimony, but we want to say that we feel this is a real critical step to helping these very poor families not only gain employment through this program, but to really get some stability in their life through these rental assistance payments. Thank you.
Okay, thank you very much. Next up, Kristen Alice for Hope Services of Hawaii in support.
Aloha, everybody. Thank you for hearing my testimony. Like the other testifiers have said, this is a smart bill, and this is a good bill to help put money in the pockets of needy families. Just that extra $500 a month would give them more opportunity for better housing, better health, better dog care maybe. But it would be a very good, critical step in making sure that our families have access to the support services they need. Thank you so much, and apologies for the dog.
It's okay, Kristen. Thank you very much. Okay, nobody else having registered to provide testimony for SB 2150. Anyone who registered late? I don't see any. Okay, so also providing comments is the State Procurement Office. Comments from Budget and Finance. In support, the Homeless Program Specialist for DHHL and the Hawaii Health Harm Reduction Center in support. Hawaii Children Action Network speaks in support. Hawaii Budget and Policy Center in support. Partners in Care Oahu's Continuum of Care in support. Okay, nobody testifying in opposition, excuse me. Nobody testifying in opposition. Nikos, are you here to testify on SB 2150? Later on. No. Okay.
Later.
Okay, so thank you. So moving on. Oh, do we have any questions of members on SB 2150? Okay, seeing none. Okay, excuse me, let me put this on focus. Okay, on SB 2169, relating to food assistance. We have in support Hawaii Office of Community Service. Are you present? Giovanni De La Cruz.
Hi, Chair. They're not present.
Okay, next one, Peggy. I see Peggy Mears. Aloha Care in support.
Aloha,
Please
Chair. Yes. Aloha, Chair. Peggy Mirza with Aloha Care. We are in support of this bill. The food banks certainly help to provide for many of our members as well as others in the community. And it is a safety net, part of the safety net system. So thank you so much for hearing the bill. Appreciate it.
Okay, thank you very much. Next up, Hawaii Food Industry Association. In support, Lauren Zerbo? No, not present. Next up, I see Amy Miller, Marvin, for Hawaii Food Bank in support.
Hi,
Please
aloha
proceed.
Chair, aloha Senators. My name is Amy Marvin. I'm the President and CEO of Hawaii Food Bank. And we stand on our written testimony in strong support of this bill, but I did want to emphasize a couple of items. I know we are all aware that food insecurity skyrocketed during the pandemic, but it remains extremely high in our state. We now have the second highest rate of child food insecurity in the country. At Hawaii Food Bank, we are still serving about 50% more people than we did prior to the pandemic. And last year, we distributed almost 25 million pounds of food on Oahu and Kauai. That's about twice as much food as prior to the pandemic. And we've been really able to reach that increased need due to a major increase in federal funds and philanthropy. But we would really need support from the state to continue to meet the needs of our community and ensure nobody goes hungry. We've been seeing federal support, federal commodities really decline substantially over the last year. And philanthropic support, while it's still higher than it was prior to the pandemic, has also declined. So this bill would really provide important support to allow us to continue to meet the needs of our community. Thank you so much for your consideration. I'd love to answer any questions that folks have.
Okay, thank you very much. I see Jonathan Ching, Kaiser Permanente in support. Please proceed.
Hi, Chair. Yes, we will stand on our, Jonathan Ching for Kaiser Permanente. We'll stand on our written testimony in support. I just want to emphasize, that similar to the previous testifier, I think there's been a lot of community support, and there continues to be a lot of food distributions by multiple agencies. But the four food banks, that are administering this emergency food assistance program is very, very vital, and I think they're kind of the critical link. So really appreciate that the committee is hearing this bill. I think, as we all like to say, we're all in this together, and there continues to be a lot of community support to ensure that those members in our community who have food insecurity are able to have their needs met. Thank you.
Okay, thank you very much, Mr. Ching. I see Nicholas Levant for Hawaii Health and Harm Reduction Center. Please proceed.
Good afternoon, Madam Chair and members. My name is Nicholas Leverance. Happy New Year. During the initial stages of the pandemic, H3RC was very proactive and deeply valued its partnership with the Hawaii Food Bank in providing regular food distribution efforts here in urban Honolulu and also on Pupukea and also on the windward side at Windward Mall. And what we see now with the lingering impact of the pandemic is that there's still a vital need to meet the felt food insecurity needs of many families here on the island, and we strongly support the measure. Thank you very much.
Okay, thank you very much. Okay, we don't have anybody else registered. I see a Shana Kukila. Are you here to testify for SB 2169? Oh,
Yes.
please proceed, Shana.
Thank you, Chair. My name is Shauna Kukila, and I'm in strong support of SB 2169. I also want to add one thing. I stand on my written testimony, but I also wanted to add that I hope that we could, as a state, help the people in Tonga as they struggle. So let us not forget those families that are separated as well. So if there's anything we can do to send them food, I would really strongly support that. So thank you very much for all you do, food banks across the state of Hawaii. Thank you, Chair.
Thank you, Shana. And I see also Marsha Fahir in support. Please proceed.
Aloha, Chair and members of the committee. My name is Marsha Fahir. I stand by my written testimony in support of this bill. I've been a member of the Maui Food Bank Board for over 5 years, and I'm not aware in my time there of us asking for funding from the state. We get a lot of federal funding, which is what Amy discussed before, and this bill will help us with our operations. We've had a philanthropic decline, as Amy said as well, so this will help us keep us alive. Thank you so much.
Okay, thank you so much. Okay, I don't see anyone else registered to testify by Zoom. Anyone there who registered late? Okay, seeing none, we have Craig Shikuma for Hawaii Food Bank, written support. Catherine Ellman, Hawaii Food Bank, written support. Maui Food Bank, support. Tiki's Grill and Bar, and support. Waianae Coast Comprehensive Center, written support. Waianae, again, Richard Bettini from Waianae Coast Comprehensive Center. Hawaii Primary Care Association, and support. Chef Point of View Consulting, and support. Hawaii Agricultural Foundation, and support. United Public Workers, Local 646, in support. Hawaii Government Employees Association, in support. Ulupono Initiative, in support. AFL-CIO, Hawaii State, in support. Hawaii Farm Bureau, in support. Hawaii Food Basket, Hawaii Islands Food Bank, in support. And we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 individuals, including the Kauai United Way, all in support. No one testifying against. Members, any questions of the ones who are here? Seeing none. Okay, we're going to move on. SB 2371 establishes, relating to homelessness, establishes statewide homelessness shelter and housing data clearinghouse with the Department of Human Services to be administered by the Governor's Coordinator on Homelessness. First up, testifying for Department of Human Services comments. We have Besdy. No, we don't have. Oh, we do. We have Harold Bracken. Go ahead.
Hi, good afternoon, Chair, committee members. Thank you for this opportunity to testify. Harold Bracken, Homeless Program Administrator with the department. Standing on our written testimony, we do appreciate this measure and we're providing comments, and I'm available for questions if needed. Thank you.
Okay, thank you very much. Next up, we have Scott Morishige, for Governor's Coordinator on Homelessness, in support. Please proceed.
Good afternoon, Chair and members. I appreciate the strong focus on data. It's so critical to develop, implement, and monitor policies and programs to address homelessness throughout Hawaii. In the interest of time, I'll stand on my written testimony supporting the intent, and I'm available for any questions. Thank you.
Okay, thank you. I see James Tabe, Office of the Public Defender, in support. Please proceed.
Thank you, Chair. Good afternoon, everyone. James Tabe, on behalf of the Office of the Public Defender, we stand in our testimony in full support of this bill. Thank you.
Okay. We also have Max Otani for Public PSD in support. Please proceed.
Hi, good afternoon, Chair. The department would stand on the written testimony in support of the intent of this measure. Thank you.
Okay, thank you very much. Okay, we also have, excuse me, Prosecuting Attorney's Office in support. Tricia Nakamatsu? No, not here. I see Nicholas for Hawaii Health and Harm Reduction Center in support. Please
Good afternoon.
proceed.
Good afternoon, Madam Chair and members. Nicholas Leverage with Hawaii Health and Harm Reduction Center. We support this measure and we hope that somewhere along the process it can be made explicit in the statutory language that individual data be confidential. Mahalo.
Okay, thank you very much. Next one, we have Laura Thielen for Partners in Care comments. I see Laura in present.
Aloha, Senator. Thank you for the opportunity to make comments on this measure. While we support the intent of collecting data from as many resources as possible, we want to continue discussions on this measure due to the importance of making sure that all data is kept confidential and private, and also the need for us to investigate the ability of all departments being able to pull data that is specific to the issue of homelessness, which at this point, most departments outside of direct services to individuals who are experiencing homelessness do not pull specific homeless statistics. So we'd like to work some more on this issue with all of the stakeholders.
Okay, thank you very much. Next up, we have Samuel Mitchell in support. Is Samuel here?
Hi, Chair, not present.
Okay, not present. Okay, anybody else who is registered late who wants to testify on SB 2371? Okay, questions, members? Okay, well, I have a couple of questions. Is Matt Fotani still present? No? Okay, what about, oh,
Yes.
hi, Matt.
Hi.
So do you have access to the database, the HMIS that Partners in Care has?
I don't think we do, ma'am.
Okay, that was my question. What about public defender? Are you folks still on? Do you?
Yes, we're
folks have
still here.
So there is a database. So what I want, it's called HMIS. So do you have access to the HMIS database?
No, we do not.
Okay, okay. So it sounds like it's limited and prosecutor didn't show up. So Laura Thielen.
Yes.
So who has access to the HMIS database? Is it basically only your agency or?
No. We have hundreds of users and dozens of providers, as well as different government entities. And just to be clear, we have not been asked by DPS or the prosecutor's office to discuss actually having access to that. The process is the same for everyone who wants access. We need to figure out why they want access and what they need access to. And we would be open to interviewing any agency or entity to that end.
Okay, so thank you very much. Is Scott Morshiga still on? Hi, Scott. So I do know that the two continuum of care people, the Bridging the Gap and Partners in Care, I see Tricia Nakamatsu. Okay, hold on, Scott. So Tricia, you want to talk about prosecutor's position on the homeless database?
Hi, Chair. I'm so sorry for being late. Something, I'm sorry for being late.
Are you parked? We want to make sure you're safe.
Not
Okay,
driving,
good.
both hands up.
Okay, sounds good. Okay, go ahead.
Yeah, so as far as I know, we don't have access to that database. It's not necessarily that we're requesting access. I mean, it's not that we're requesting access to it. We just support the general concept that shared data is going to lead to better data, which would then lead to better data-based initiatives, which we strongly support.
Okay, so are you aware that the nonprofits, at least the continuum of care, there is the Neighbor Islands one called Bridging the Gap, and on Oahu it's called Partners in Care, that they each have separate databases that's dynamic, really, that says where the services are, where the beds are. Are you aware that there's already a database? And if you are aware, why do you folks want another one?
I don't know. We're not actually that involved in the process. We had just, it appeared that the government agencies weren't tied in and weren't all contributing data to the same database. And so we felt that if everyone's on the same page, that would just generally lead to better data collection.
So do you know of any government agencies that are not tied in that should be tied in?
We were just I think we're primarily basing it off of the bill, and the bill had indicated several agencies.
Okay, thank you very much. So Scott, are you on? So I am fully aware about the HMIS databases that's dynamic, that's on the neighbor islands, and that is in Partners in Care, and it used to be statewide, but then they decided to be more nimble, they wanted separate databases. And this bill wants a statewide database, which seems contra indicative of where we were before. But are you aware of any governmental agencies that should have access to the databases that is not?
Well, thank you, Chair, for the question. I think in terms of direct access to the HMAS, I think the question would be about client confidentiality and privacy, particularly for an organization like the prosecuting attorney, where they could potentially use the data for purposes other than just the delivery of services. I did want to note that there's other available data that my office consolidates in addition to what's in the HMAS. We do make that data, for example, about emergency shelter vacancies, updated Monday through Friday, available to other departments like Department of Public Safety. And we share that information with our reentry staff.
Okay. Okay, what I'm leaning towards, because I do know that Senator Moriwaki is working with a whole group of people who believe that they need access to this database, but are not getting access, is to form a working group to find out where the holes are, okay? And I will let my decision, I have let my committee members know that that's what I'm working towards, so that the privacy issues, the HUD restrictions are taken care of, and that we just don't go backwards when we used to have a statewide and now we have chosen to not have a statewide, that we not go backwards and continue to move forward and not use monies that could be used for the homeless instead of creating another bureaucracy. So that's what I'm thinking about. It's a working group instead of actually creating the database. Any comments on that, Scott?
Senator, I think I'm very open. I think anything we can do to facilitate more conversation about the good use of data, I'm supportive of. So
okay.
I appreciate your focus on this.
Okay, thank you very much. Okay, any questions, members? Okay, seeing none, we're going to move on. SB 2461, making appropriation to the Hawaii Healthy Aging Partnership Program, appropriates money for the Hawaii Healthy Aging Partnership Program to the improving the health and well-being of Hawaii's kupuna. First up, Carolyn Cadial, Office of Aging.
Good afternoon. Good afternoon, Chair and members of the committee. Caroline Kadirao here with the Executive Office on Aging. We stand in strong support of Senate Bill 2461 for our Healthy Aging Partnership. Now more than ever, with the ongoing pandemic, programs such as enhanced fitness and better choices, better health are needed to help reduce social isolation and to keep our kupuna safe, healthy, and fit. This is not part of the administration budget requests, and we support this intent as long as the enactment does not reduce or replace priorities with the administrative budget requests. Thank you for the opportunity to testify.
Okay, thank you very much. And I see AARP Audrey Suga Nakagawa in support. Please proceed.
Yes, so good afternoon again, Senator and members of the committee. AARP stands in strong support of this funding request. The Healthy Aging Partnership has been a long-standing program that has demonstrated to be very successful in keeping our kupuna healthy and being able to age well and manage their chronic conditions. And we're really pleased that they were able to pivot into a virtual format and provide alternative way of learning and teaching with the pandemic. And so, I think it definitely deserves to continue to be supported. And, in fact, with the virtual, and even if one day we go back to in person, I think this will even expand the access for people who might not be able to drive to these classes or get to these classes by transportation. So it really has been, in many ways, a blessing in disguise that we're able to see how this program can have far-reaching reaching engagement of our kupuna. So thank you very much for this opportunity to express our support for this bill. Thank you.
Okay, thank you very much. Okay, nobody else having registered to testify in support or against SB 2461. Anybody there registering late? Seeing none, those who have testified, provide written support are Hawaii County Office of Aging, a policy, PABEA Policy Advisory Board on Elderly Affairs in support, Hawaii Family Caregiver Coalition in support, and 4 other individuals in support, and budget and finance comments. Any questions, members? Judith Clark, are you here for SB 2461? No.
No, I'm here for the
Succeeding one
coming next.
Okay, thank you. Okay, members, any questions of the witnesses for SB 2461? Okay, seeing none, moving on. SB 2481, relating to youth crisis centers, establishes the Youth Crisis Center branch of the Office of Youth Services and position of Administrator of the Youth Crisis Branch of the Office of Youth Services. And those testifying are Office of the Public Defender and Support, Darcia Forrester, or Office of Public, I see Darcia, please proceed.
Aloha, we stand in very strong support of this. Anything to help our youth be successful, we are in support of. Thank you very much.
Okay, thank you very much. I see Scott Murashige providing comments. Please proceed.
Good afternoon, Chair and members. Support the intent of this bill and defer to Office of Youth Services regarding their specific efforts to scale youth services. I'll stand on my written testimony supporting the intent. Thank you.
Okay, thank you very much. I see Office of Youth Services here. Please, Leanne Gillespie providing comments. Please proceed.
Yes, good afternoon, Chair and members of the committee. My name is Leanne Gillespie. I'm the Administrator of the Office of Youth Services. We stand on our written testimony in support with comments, and I will be available to answer any questions. Thank you.
Okay. Also, who has registered is DHS SSD Director. Anybody here for DHS SSD? Okay, seeing none, we're moving on. Hawaii Youth Services Network, Judith Clark, your turn. In support.
Aloha, I'm Judith Clark for Hawaii Youth Services Network. I will be very brief. This is a highly vulnerable population. Intervention at times of crisis can make a huge difference in whether they grow up safe, healthy, and ready to succeed. Our data on street youth shows that more than 3/4 of them have been physically, emotionally, or sexually abused. 41% were forced to leave home by their families. 9 out of 10 have slept outdoors in a park, beach, or sidewalk, and 40% of them have been beaten or assaulted while they were on the streets. Services for this population are very much needed. The existing resources do not meet the need at this time. Thank you for this opportunity to testify.
Okay, thank you. I see Eladine Oleval. Are you here to testify on SB 2481, which is the Youth Crisis Shelter? Please proceed.
I am. Aloha, Chair and members of the committee. I am Eladine Oleval, and I am here representing Child Welfare Services with Department of Human Services, and we stand by the written testimony that has been submitted and will be available for any questions that you may have. Mahalo.
Okay, thank you very much. Okay, and I see Daisy Hartsfield for Department of Human Services. Please, this is for SB 2481. Are you testifying for that, Daisy?
Aloha, Chair. Actually, I'm going to testify for the next bill, Senate Bill 24.
Okay, that's fine. That's fine. Okay, anybody else registering late for SB 2481? Okay, seeing none, we have written comments from Budget and Finance, Opportunity Youth Action, Hui, and Support, and 2 other people who testifying in support. Members, any questions of the witnesses testifying? Okay, seeing none, moving on to the last bill, SB 2415, relating to child abuse. Adds a requirement that the Department of Human Services expunge a report for reports when the department finds a miscarriage of justice would persist if the report or reports were not expunged. Requires the Department of Human Services to provide notice to all parties who are placed on the Hawaii Child Abuse and Neglect Registry. Provides an avenue for persons for the Hawaii Child Abuse and Neglected Registry. So SB 2415, Daisy Hartsfield, you're going to be testifying for Department of Human Services?
Yes. Good afternoon, Chair and members of the committee. I am Daisy Hartsfield, the Social Services Division Administrator for the Department of Human Services. First of all, I want to apologize for any confusion or inconvenience for my late testimony notifying the committee that I would be testifying on behalf of the department. That said, the department stands by its written testimony, providing comments as well as requesting clarification, and I'm available for any questions. Thank you.
Okay, thank you very much. We also have Shannon Franco testifying in support. Okay, Shannon's not here. Anybody else registering late, wanting to testify on SB 2415? Okay, seeing none, we have comments from Department of Human Services, Hawaii Family Advocacy Team, Marilyn Yamamoto in opposition. In support, we have Robert Cortero, Dara Carlin. We have comments from Shana Kukila, and we have opposition from Maria Tijarina. Members, any questions of the witnesses we have available? Okay. Oh, Shana, do you want to testify? Shana, do you want to testify on SB 2415?
Yes, Chair. Thank you for the opportunity to come before you today.
Okay, please proceed.
My name is Shana Kukila, and I stand on my written testimony, but I want to make another a caveat to my testimony, and that is, if you read my testimony without any background, you might think that I'm against child welfare services and for people to be held accountable for child abuse. However, my testimony is about having a registry where it's almost impossible to get your name off. You can get your name expunged off of a criminal conviction, but you can't get your name off of this list. And in order to do something like that, there would have to be some kind of more, I guess, a law that does more than what this one does. I actually don't support having a list because I don't feel that child abuse should be put on a list. It should be a criminal conviction that is held in the record, not these kinds of lists. So it gives people the idea that they can use it when people in the welfare system, the idea that they can use this list against parents in the future. And so it's not conducive to strong, healthy families. So I would ask that you read my testimony. And I also testified on 2343, but didn't make it in for some reason. I don't believe that there are many parents in the child welfare system or many in the family court system that are able to afford to appeal. So we need to fix things before they get to the appeals process and before they get to the Supreme Court. So if we focus on the constitutional rights of children and families before it gets to the point where we have to take it to a higher court, that would be the best remedy. So thank you for my opportunity to testify today. Thank you so much, committee members and chair. Aloha.
Okay, thank you very much. Okay, members, any questions of Shana? Okay, seeing none, let's recess for decision making. Calling the Human Services 310 calendar for decision making. For SB 2343, Chair's recommendation is to pass with amendments to accept the judiciary's proposed amendment by adding a section 3, authorizing the Supreme Court to grant an application for transfer of any appeal in the ICA involving the custody of children. Technical non-substantive amendments for purposes of clarity and consistency, and adding a defect date of December 31, 2050. Any questions, comments? Vice Chair for the vote.
Okay, we're voting on Chair's recommendation to pass Senate Bill 2343 with amendments. Chair
Votes aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Misalucha is excused, and Senator Favela.
Aye.
Recommendation is adopted.
Okay, thank you very much. So for SB 1294, Chair's recommendation is to insert the SB 2401 Section 1 preamble with the change on the last paragraph. The purpose of this act is to appropriate funds to restore the above described option 1 of basic package of diagnostic, preventive and restorative dental benefits to adult Medicaid enrollees. And on section 2 in the blank, insert $10,195.82. $10,195.82. Change the effective fiscal years to another year, so 2022 to 2023, same sum of 2023 to 2024. Remove lines 7 through 12 and insert a effective date of December 31, 2050 to ensure to see whether or not the Human Services budget passes with this allocation. If it does pass with this allocation, then this bill is unnecessary. But if it doesn't, I'd like to keep this alive, and that's the reason for defect date. Any questions, members? Seeing none, Vice Chair for the vote.
We're voting on.
Chair, this is Yuko from SMA. Because we are in the second year of the biennium, we cannot appropriate budgets or allocate budgets beyond 2022, 23. I believe you mentioned allocating for 2023 and 2024. We are not able to do that this year.
Okay, so thank you. So with the correction of just allocating for the 2022 to 2023 year. And so lines 4 through 12 on page 7 will be deleted based upon SMA's recommendation. Any questions? Okay, seeing none, Vice Chair for the vote on SB 1294.
We're voting on Senate Bill 1294 with amendments, to pass with amendments. Chair Sandra Ventura.
Aye.
Senator Hara votes aye. Senator Ocasio.
Aye.
Senator Misalucha is excused. Senator Favela.
Aye.
The recommendation is adopted.
Okay, for SB 2153, Chair's recommendation is to pass with amendments. We're going to insert into the blanks in section 3, $3,557,520. Insert in the blank under section 4, $16,206,480. We're going to add a section 6, allocating an appropriation of $200,000 to Department of Human Services for system enhancement for case management and payment systems to implement the measure. We're going to add a defect date of December 31, 2050 to ensure that the budget and finance concerns are met. Any questions, members? Seeing none, Vice Chair for the vote.
We're voting on Senate Bill 2150 to pass with amendments as mentioned. For the 4 members of the Human Services Committee who are present, any objections or reservations? Otherwise, I'll cast an aye vote for the 4 members present.
Thank you very much. Okay, for SB 2169, Chair's recommendation is to pass with amendment We're gonna add a section 4, allocating 15% of the above sum to be set aside for administrative purposes among OCS, Office of Community Services, and the 4 county food banks. And all allocations, including the administrative monies, shall be divided under the Small Area Income Poverty Estimates, or SAIPE formula. We're also going to add a defect date of December 31, 2050 to take into account budget and finance concerns. Any questions, members? Okay, seeing none, Vice Chair for the vote.
On the chair's recommendation to pass Senate Bill 2169 to pass with amendments, any objections or reservations for the members present? Recommendations adopted.
Okay, thank you very much. Okay, for Senate Bill 2371, Chair's concern is that we already have homeless shelter and housing databases, but there are issues with it. So instead of passing this bill, Chair's recommendation is to pass with amendments, creating a working group, removing everything under SB 2371 and replacing it with a creation of a working group consisting of 1 member of each of the continua of care, a member of at least 1 member of each of the 4 prosecutors' offices, the public defender office, Hawaii Police Department, and the public safety department, the governor coordinator on homelessness, the Senate chair of GDO or HMS and the House equivalent, a member of the Office of Enterprise Technology Services, and a member of the Attorney General's office to ensure that the HUD restrictions on financing as well as privacy restrictions are taken care of. The request is that this working group create a report 20 days prior to the next legislative session. Basically, 1, on how to create a statewide database under HUD and privacy restrictions. 2, a recommendation as to whether or not the benefits of a statewide homeless shelter and housing data outweighs the cost, especially with the existence of current data that's already out there. And 3, if it does outweigh it, whether or not it should be part of the Department of Human Services budget. We're going to also put in technical non-substantive amendments for the purposes of clarity and consistency and add a defect date to continue the conversation. Any questions? Okay, seeing none, Vice Chair for the vote.
We're voting on Senate Bill 2371 to pass with amendments for the members present. Any reservations or objections? Hearing none, I'll cast the aye vote for the members present.
Thank you.
Measure is passed.
Okay, for SB 2461, Chair's recommendation is to just add a defect date and to pass as is December 31, 2050, to take into account budget and finances concerns on the ESSER funds. Any questions? Seeing none, Vice Chair for the vote.
On Senate Bill 2461, recommendations to pass with amendments. Any reservations or objections from the members present? Otherwise, the recommendation is adopted.
Okay, for SB 2481, relating to Youth Crisis Center, there's already a blank appropriation. So all we're going to do is fix the typographical errors on line 10 and line 12, add technical non-substantive amendments for the purposes of clarity and consistency. Any questions? Seeing none, Vice Chair for the vote.
Members.
Chair, I'm sorry. Again, this is Yuko from SMA. Would you like to defect the date for this one?
No, there's already a blank appropriation. There's no need to.
Thank you.
Okay, thank you.
Okay,
go ahead.
On the chair's recommendation to pass Senate Bill 2481 to pass with amendments, any reservations or objections from the members present? Recommendations adopted.
Okay, thank you very much. Okay, next one is 2415. Most of the testimony is in favor of this bill. It does need more work though. So we're just gonna defect date this because the introducer is working with Human Services as to what can be done. And otherwise pass it with amendments, with just a defect date. And hopefully we can fix it before conference. Thank you very much. We're passing it on to JDC. Hopefully everything gets fixed by then. Any questions, comments? Okay, seeing none, Vice Chair for the vote.
We're voting on the chair's recommendation to pass Senate Bill 2415 with amendments. Chair Senator Ventura.
Aye.
Vice Chair votes W. Reservations, Senator Casio.
Aye.
Senator Favela.
Aye.
Recommendation is adopted.
Okay, seeing that there are no further bills, we are adjourned. Thank you very much, folks.